Hello, my name's Nate Savage. This upcoming year, I'll be a third year in the undergraduate public health program here at the University of Iowa. This past summer, actually, however, I was able to complete my experiential learning at the Johnson County Health Department as an internship. So in this video, I'll kind of break down my poster and talk about that a little bit. So here we go. So the whole purpose of this experience I did, it was all about coronavirus, which, as I'm sure we all know, it hit the US pretty hard in, I'd say, early spring. I'd say March, April, that's when it really started to rise. So the whole point of this internship actually was to help slow down the spread and prevent the transmission of the coronavirus throughout the community. So we would see cases, contacts, and pretty much the whole point of this was to get in touch with them and relay this important information we need to know about isolation, quarantine, and the next step for them. So, and this relates to public health very much so because this is a new virus. We don't know much about it. There's no direct or immediate solution to it. With that being said, there's a whole lot of other populations that are at risk, especially ones with pre-existing conditions or immunocompromised conditions. So by help preventing the spread, we are helping the community from contracting this possibly deadly virus, and we're just keeping the community safer overall. Next, how has this community shaped your academic and or career goals? Very much so. I've really enjoyed this internship, and the one thing that it has shaped is it's only proven that this is the path I want to continue to go down. I've had a lot of fun this summer. I've learned a lot. It's been really nice to be able to apply some of the skills I've learned in the classroom out in real life. And so it definitely has helped solidify that this is what I want to continue as a career path. This has helped some of my academic goals because I do feel as if I work very hard in the classroom, and so it's been nice to kind of apply this to a real life scenario where it actually affects people. I've taken a lot of coursework, and I feel like I've had a lot of practice in the classroom, but I've never been able to apply that to a real public health job. So it's really interesting to be able to apply that in real life scenarios and feel like I actually am making an impact because I am kind of making an impact in the community, and it feels nice to be able to have a positive effect on others. What did I learn from this experience? I really learned about the importance of it is to make connections with the staff. I didn't have a whole lot of connections before this. I felt like, and it was really nice to be able to get to know the staff better. In the beginning, the first couple of days, I didn't know them that well, but as kind of our workload increased, and the more I started working, the more I became more familiar with the staff, and they became more friendly, and work became much easier. It was also kind of interesting to see kind of how the government, public health, and the community all interact between each other. Because we would all have to modify certain stuff we did, whether the government released some new policies or something. So then the Johnson County Health Department would kind of have to modify some of our recommendations or make it more community friendly, just to make sure we're reaching the community in the most effective way possible. So it's kind of interesting to see how those three things kind of interacted to see the final product for what we would be telling people. Um, Another thing I learned from this experience, kind of with my academic goals from the previous question, was that epidemiology is something I want to continue as well. Environmental health and epidemiology were my top two public health interests coming into this, and I'd say they still are. I'm not gonna say what one's the top one, but this has definitely solidified that epidemiology is something I want to continue to pursue. It's very interesting to see kind of how the virus has spread, ways to stop, prevent it, and just kind of the problem solving skills that go along with that. So, and will I continue in this field in this organization, and in what capacity? I will be continuing. This fall, I actually will be joining the Johnson County Health Department as a part-time employee, and I'll be continuing with the contact tracing team. So I'm excited for that. So that's for this upcoming fall. Long term, though, I still am interested in this as well. I'm not sure if I'll be working at the Johnson County Health Department the entire time, but this definitely gave me a good step in the door for maybe epidemiology or just county public health. But I definitely, this is something I want to keep on exploring. So I'm very glad I was able to do this summer, and I was very glad I was able to make the connections I did with the staff, my coworkers who I had some classes with prior, so I knew them a little bit coming into this. But overall, it was a very good experience, and I'm glad this was the way I got to complete my experiential learning. So thank you.